Hi, it's Dr. Clark. I want to talk to you today about peripheral neuropathy. Okay, how do you get it, what causes it, and what's being damaged? Okay, and today we're going to touch on these nerves right here called LDAs. LDAs stand for large diameter afferent nerves. Afferent nerves carry signals from your body to your brain. Okay, and so these are the large diameter ones, are the ones that cause you to begin to lose sensation from your feet to your brain, and it can lead to not only numbness and tingling, but also loss of balance, poor coordination, falls. When I see loss of LDAs, this is one of the most important things for me to get restored in a peripheral neuropathy case, because you are at high risk for falls. And the number one reason, unfortunately, that seniors die is because of falls. And so, what are large diameter afferents? First of all, there are nerve receptors in the joints and other tissues around the joint of the feet and even other joints that send signals up the nerve through the dorsal root ganglia into the posterior horn of the spinal cord. Inside the spinal cord, there are what's called lamina. Okay, now one of the things that LDAs do for you is when it fires into the back part of the spinal cord, it drops off what's called a collateral or a nerve extension into the lamina number 2 of the spinal cord. This area actually, by this firing into there, it actually blocks pain. So one of the reasons why you have pain in your feet or pain in your hands is because you're not getting firing of the LDAs, and so therefore you're not inhibiting pain. The other thing that it does is it sends a signal up the dorsal part or the back part of the spinal cord up into the medulla, where it decussates or crosses over, goes into the ventral posterior lateral nucleus of the thalamus, and then over into the brain in the parietal lobe of the opposite side of the body. So the right foot would fire into the left brain. Now, one of the problems is whenever you lose LDAs, not only do you lose this inhibition of pain, not only do you lose this sense of where your feet are in space, so therefore you become more at risk for falls, but you also lose normal stimulation to the brain. And so the brain now becomes not as effective at feeling normal sensation. So this is one of the things that we must restore, is we must, number one, get the LDAs actually working again. Number two, we must get the brain to learn how to feel normal sensation again. Because remember, the brain gets good at doing what it does. So if it senses pain all the time, what does it get good at? Sensing pain. If we have to retrain the brain also to sense normal sensation again. And we work with you in the rehab area doing this, teach you home exercises and home activities to be able to do this, like the rubber glove treatment and things like that, which I will explain when we evaluate you. Now, so how do you know if you have a loss of LDAs? Well, there's a number of ways. Number one, vibration sense. If we put the tuning fork on your shoulder and you feel that, and then you put it on your toe and you don't feel it the same, that's a sign of a loss of large diameter afferents. If you lose joint position sense, so you can't tell that your joint's moving with your eyes closed when you should, that's a loss of large diameters. If you lose 2-point discrimination, that's another sign that you're losing these type of nerves. And these nerves are some of the first ones affected in a peripheral neuropathy case. So, hope this information helps you kind of understand what's going on. There are some techniques to restore this. We'll talk about this on another video. I'll also be discussing this in detail in the workshop coming up in our office. So be watching for that, and God bless you and have a great day.